A newborn has a tight membrane covering the body along with atropine and eclabium. Which of the following is the least likely diagnosis? Right answer is option C, Ichthyosis vulgaris. Babies with a colloidal membrane, atropine and eclabium usually have severe congenital ichthyosis. Ichthyosis vulgaris develops later in childhood, so it is a least likely diagnosis. Which device is used to monitor a person's exposure to radiation? Right answer is option A, TLD badge. A thermoluminescent dosimeter or TLD badge is worn by healthcare workers to measure and monitor their radiation exposure over time. Which tendons form the lateral boundary of the anatomical snuff box? Right answer is option D, extensor pollicis brevis and abductor pollicis longus. These two tendons form the lateral border of the anatomical snuff box, while the extensor pollicis longus forms the medial border. What is the main function of the proteasome inside a cell? Right answer is option B, protein degradation. The proteasome breaks down damaged or unwanted proteins, helping the cell recycle amino acids and maintain healthy protein balance. Replacing alanine with which amino acid will increase a protein's UV absorbance at 280 nanometer? Right answer is option B, tryptophan. Tryptophan strongly absorbs ultraviolet light at 280 nanometers, so replacing alanine with tryptophan increases the protein's UV absorbance. Which layer of the cornea is responsible for keeping it clear and properly hydrated? Right answer is option A, endothelial cells. These cells pump excess fluid out of the cornea, keeping it clear, transparent and properly hydrated. Which finding is most characteristic of a fungal corneal ulcer? Right answer is option B, satellite lesions. Fungal corneal ulcers commonly have small satellite lesions around the main ulcer, which is a classic diagnostic clue. In patients with MEN1 syndrome, where is a gastrinoma most commonly found? Right answer is option B, duodenum. In MEN1 syndrome, gastrinomas most commonly arise in the duodenum and cause excessive acid production. A 50-year-old chronic smoker develops pain in both thighs and buttocks after walking about 500 meters. Which arterial disease is the most likely cause? Right answer is option C, Aortoiliac arterial disease. Pain in the buttocks and thighs while walking is a classical sign of reduced blood flow from blockage in the aortoiliac arteries. Which antifungal nail lacquer belongs to the morpholine group? Right answer is option A, Amorolfine. Amorolfine is a morpholine antifungal commonly used as a nail lacquer to treat fungal nail infections.